Ziploc baggie, and I carried it in my left pocket all the time I was in Vietnam. And the 23rd Psalm is what he gave me. And I think everybody knows the 23rd Psalm. So, and I did walk through the valley of the shadow of death. But God took care of me. And when I was over there, everybody'd say, well, hey, Bruce Pearson, what's going to happen? Anything going on? And they always said I ducked before they started shooting. Well, you know, I think I did. I think I had a guardian angel tap me on the shoulder. Somehow I always knew. Just got that feeling. And I got shot at a few times. That's like my hat has the rifle with the oak leaf cluster around it. And the only way you can get that is you have to actually be shot at and be able to prove it, and they give you that. So they did try to shoot at me, and they never did hit me, thank God. I did learn what fear was about over there. You know, you had that fear. And AK-47 had the most horrendous sound you ever heard, because their bullets were tapered like this, like a point, flat and tapered. Ours were like this. So when they shot at you, of course, you'd hear the muzzle flash sound after. You heard the sound barrier being broken by the round. You got a double clap there. And that AK-47 had a sound you never could forget. So you always knew when it was, you know, what it was that was shooting at you. And it's just like one time we got pinned down. We were assaulting the wood line, and we knew it was a BAR because you could hear the BAR when they were firing. They were shooting at us with the BAR, and it had a slower action. And the way that when they were firing, it was just doom, 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 real slow. And any other ones were faster, like a lot faster than that.
Is that like a 50 caliber?
No, it was a BAR was about the same as an M14. Pretty close to the same round, I think. You're taxing my memory now, but 50 caliber, we had 50 caliber on the berm, and the Vietnamese, for some reason, they worked everything around where they could take their AK-47 and put an M14 round in it. But we couldn't take an M14 and put an AK-47 round in it. They were really pretty ingenious on some of this stuff. They had what they called a 51 millimeter Chi-Com machine gun that was like a 50 caliber. There's a lot of differences, which I remember once we were flying along in a helicopter, and they shot at the helicopter that we were in, and down where their feet were, the co-pilot, it was like glass underneath there, so they could see better, I guess, to land. And this tracer came right up between the co-pilot's leg. That was too close for comfort for us, yeah.
You know, I heard someplace those guys that were the gunners on those machine guns, their lifespan was like less than a minute or something. I mean, it was just some really small amount of time.
That I don't know about. We had the first air cab that flew for us, and those guys were absolutely insane. But they would come in to any time they picked you up, and you'd have like seven. You might have, depending on how big of an operation you were on, you might have 7 helicopters, and they'd come in, and all the outside door gunners would open up with the M60 machine guns. They had them on a little pivot, and like almost I don't know how long the belt was linked, but when they came in, and they would fly at treetop level, just brushing the trees, you know, with the skids, and they would sit there, and we were waiting for them to come, and they'd say they're about 15 minutes out. We'd be waiting. They said about 5 minutes out. And then all of a sudden you'd hear the god-awfulest whop, 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 and all these helicopters would just come off of the trees and drop down and pick you up. And they did that so that, you know, they couldn't shoot at them. If they were up in the air, they could shoot at them. So those guys were crazy. I don't know what their lifespan was, But I watched a couple times when they was wounded people, and they would fly into hell with a medevac helicopter, literally, to pick people up and not think anything about it. I don't think I'd have wanted to have been a door gunner on a helicopter, but no, I don't know. I know when you were there, the majority of the people that were killed in the first month or the last month.
Oh, my goodness.
Yeah. That's why I always said Nixon, when I was there, Nixon pulled us out. He pulled the 9th Infantry out in 1969. And they had a thing where if you were there 0 to 6 months, you got reassigned to the 25th Infantry. And if you had 6 to 9 months, you went back to Hawaii. And if you had 9 months to 12 months, they gave you what they called an early out. Now, I was about 9 months. I was almost 9 months because I was supposed to go to Australia. I had my bags packed and American money. And old Sergeant Thatcher didn't care too much for me, I guess because he was a Southerner and I was a Yankee. And he come walking over and said, "Hey, Pearson, you're not going anywhere. Nixon just canceled all R&Rs and leaves. We're going home." So, and then I wound up in the 25th Infantry for about a week or two. And they come and said, "You're not supposed to be here." I said, "Oh, that's Sergeant Thatcher again." But they sent me back and we went home to Hawaii. So I spent about 9 months in Hawaii, something like that, and then got out. So I voted for Nixon, even despite my in-laws were all in the school, you know, teaching and in the school system, and they hated him. And they would walk around and, "Would you buy a car from this man?" I guess it was pretty bad even then. I just never realized how bad it was. But I did vote for him because I figure get out a month or so early may have saved my life. But come out of it pretty well adjusted. They sent me down to Fayetteville once to be evaluated by a psychiatrist. We sat there for a good 2 hours. My wife, I had a 1-ton dually Dodge, and sitting there running. And she sat outside, and it was about 100 degrees out for about 2 hours with it running. Of course, that thing, when it didn't matter, it blew air out of the duct about 32 degrees. And I was in there for pretty close to 2 hours, and just about the time we got done, he looked over at me and he says, "Bruce, did you ever think about committing suicide?" And I looked at him. I said, "Well, when I went through my first divorce, I thought about it, but then I realized I'd have to die to do it, and I didn't want to die." And he laughed at me and he said, "Get out of here. You're okay."
Well, hey, let me do this. At 11:35, I told Brad that
Yes.
we'd bring him in. You want me to bring him in now?
Yep, sounds
sure?
good. Sounds good.
Let's see if I can find this man. For those of you that have watched the new Gold Standard, Brad was on the show about, I want to say October 2nd.
Hello, it's Brad.
Hey, Brad, Tony, and Bruce.
Hey, guys, how are you?
I'm doing good.
Can you hear us okay?
I can hear you. Can you hear me okay?
Yeah.
I can hear you real good.
Well, hey, everybody. This is Brad Gibson. I was just telling Reverend Bruce here that Brad was on the show, I want to say October 2nd, and did a real good job as far as talking about some of the things that his company he represents can do to help veterans, and some of the things that are out there with Medicare Advantage plans that, if they're coordinated, right with the different
VA and
yeah,
Yep.
they could really do a good job and work together and stuff like that. Hey, Brad, since we're just bringing you on, we've already been talking for about 35 minutes, but what's going on in your world?
Well, it's that annual enrollment period that right now is just a lot of questions, and 2020 plans are out, and members are really kind of taking a look back at their policies and their medications and doctors, and just trying to come up with that game plan of their health going into the 2020.
I bet that keeps you busy. How many states do you cover?
So I've got a lot of the Midwest, Iowa, Nebraska, Kansas, Missouri is where I kind of work with agents and members across those 4 states, and a few scattered around in Florida as well.
Do you have any words of wisdom or words of advice for, let's say, a veteran that maybe, is just now approaching, say, 65, is not disabled, on what they should be aware of?
The biggest thing is to make sure that they are enrolled in the VA. That's the first thing that we kind of, want to advocate for with our Veterans Initiative program. Veterans that are not enrolled in the VA, sometimes they don't realize that, when they're trying to save funds or look at their peers, if they're not enrolled, the VA is not getting any benefits from that. And what they can really do to try and help the VA and their peers they're using the VA is getting enrolled, whether they're using the facility or not for their primary care or their health issues. It at least gives that VA the funding to help take care of those that do need it. So that'd be the first and foremost, just making sure that you are enrolled in the VA so you have that option, or seeing where you're at with that enrollment there. The second thing is just making sure that you start looking at that network of doctors. Who is your primary care physician? What are the drugs and medications that you're taking? And depending on the route that you take with your Medicare, a lot of it's going to start coming down to what can you do to be preventative maintenance on your health. Things will start to happen quickly, and when you're in one route of your age and you're trying to get services taken care of, you end up having to facilitate a lot of that on your own. So it gets to be very confusing if you're going to a back doctor and a primary care physician and maybe a knee doctor. Depending on the method that you are using your Medicare, you may be the one that's coordinating all those. So one doctor may be prescribing some medications as well as another, but do the two counteract each other? Do they enhance each other? So just start to be very preventative maintenance on your health, and knowing and understanding what doctors you are seeing, making sure that you are communicating between them. I'm taking these, I'm doing this, and be upfront and open with your doctors. A doctor can't help you with your symptoms if they don't know everything about it. So
True.
And what's the, not Medicare, but what's the one for veterans, the other insurance?
TRICARE?
TRICARE, thank you.
Right.
Yeah. So TRICARE, and that's going to go through your veteran service officer. So you're going to want to make sure you always speak to your veteran service officers to make sure of your eligibility. And TRICARE is a great program that our veterans and service members, if they're through enough service time or deployments, will be allotted a certain amount of percentage. But they'll also get TRICARE, which will be almost acts like a supplement. So when you think about traditional Medicare when you're 65, is it 80% coverage rate? So anyone who is 65 years of age, they've worked 10 years of employment, they're paid into Part A, which is your hospital and facilities. Then you'll have a Part B, which is a doctors and everything inside of that Medicare is a $135.50 Part B reduction out of your Social Security. So those two things are through your working years, only cover 80%. So when you get into TRICARE, it really acts as like that supplement or that 20% coverage outside of the VA for outside facilities wherever Medicare is accepted. So if you're on TRICARE, that you want to make sure that you get to know, that Wisconsin's Physicians Mutual is the company that runs that here on the west of the Mississippi. Get to know that you have that policy and whether you're going to the right facilities or not.
Well, now I know not everybody that served this country comes out with TRICARE for life. Some of them have TRICARE while they're in, but then when they get out, I don't know if it lasts for a couple of years, but I don't know, maybe.
I'm not sure, but I think it depends on how long you're in. The longer you're in, if you go a certain amount of years and then retire, you do get it for the rest of your life. The one thing
there's a lot of factors, places of deployment, time in service. So a lot of those questions, you really need to speak to those veteran service officers. They're going to be your first and foremost communication line. They'll have all the access and insides. I never really want to get into what is covered and what's not with a veteran, because the military has their own set up organization for that. So your veteran service officer is going to be your first communication line to how much you are covered.
Right. You brought out one point that I never knew, and I was amazed when I found it out, and I think everybody should know about it. And if you are a disabled veteran and you're covered 100% because of your disability, you still need to have the Medicare supplement. And I didn't realize it, and I did find out, they told me, that they cannot bill Medicare. But if you have a supplement, the VA can bill the supplement for parts of your care. So like you said, it helps the VA if you do have a supplement. If you think it's not
and
important.
there's two different routes with that. You have your Medicare supplement and you have your Medicare Advantage. So a lot of times what happens is the Medicare Advantage plans are also able to do that with the coverage, with the copays that would exist, but then your VA, depending on what was sent. There gets to be a lot of billing questions when you work with VA and your Medicare plan. So it's extremely important if the VA is sending a service officer or someone to a facility outside the VA. If the VA is sending them, that member really needs to make sure that they're presenting that VA card to that facility. Otherwise, they'll be charged the copays from their outside plan. So there gets to be a little bit of confusion with the billing part.
Right.
Now, well, before we brought you on, Brad, Reverend Bruce was talking about there was one that pays him 40 or 50, what is it, $40 a month? Or?
It's $40 or $50. I'm not sure how much it is now. The Humana plan where I am covered, I don't have to pay anything for prescriptions through the VA. So my insurance man said, you should get this Humana because you can go without the Part D for the medication, because all of my medication is taken care of by the VA. So if you are a disabled vet, you can get that Humana plan, especially for disabled veterans that have their medications covered, and you will save, it's $40 or $50 a month they don't take out, where you said it's like $139 or something like that. Whatever the price is they take out for your supplement a month out of your Social Security, they drop the medication and give you back money instead. They don't take as much out. And I'm not sure what the amount is, but I think it's $40 or $50 difference.
Yeah, you're exactly right. It's actually $40, and it's called a Part B reduction,
Right.
or Part B give back. And that is such a great plan that I use with veterans all across. I was in Fort Riley a couple weeks ago speaking with some veterans there, and that's exactly, it's a Medicare Advantage plan. So what happens is, you're only going with the MA side of the Medicare Advantage side of it. You're not doing an MAPD, which stands for Medicare Advantage Prescription Drug. You're doing your prescription drugs to the VA, which that is the model way of doing it. You're exactly doing it correctly. You do your drugs through the VA. You get any services that you wish through the VA. But you have that MA plan that you can have that outside care, that outside doctor. Any of those plans will cover a network of doctors outside, and they give you that $40 a month give back. They'll cover dental, they'll cover vision, they cover a bunch of other things, and it's all with the preventative maintenance mentality of making sure that you stay healthy, so that you're not having to go to the hospital on reactionary on what happened.
Isn't Humana the one that's got that silver sneakers feature?
Yeah.
Yep. So it's a gym membership that you can get access to gyms across your community, and you can go to 2 or 3 different locations if you wish. Go to one in the morning for coffee and working out, and then in the afternoon if there's afternoon programs somewhere else that you like. And again, that's just a gym membership that's given to you to stay healthy and to get you interactive and socializing.
Keep moving.
Brad, there's one other thing that I want to bring attention to also that I didn't know about when I was awarded my disability. And if you have a spouse and you're disabled, your spouse is eligible for CHAMP VA. And I had filed, and I called to see if she was eligible, and then I filed back to when I was awarded disability, and got a retroactive claim because I didn't know she was eligible. But what the Champ VA does for my wife, she's got the Medicare and the plan. You know, it's, I think hers is United Healthcare, but all of her co-pays for anything, Champ VA pays back.
Yep.
So people, if you're disabled and you have a spouse, call Champ VA and see if your wife is covered, because that would be quite a savings to do away with all of the medication copay and any copays you have for any medical expenses, surgeries, or anything. They pay the copay.
Gentlemen, I've seen the golden microphone appear in the background again. Brad, can you hang with us just for a few more minutes?
You got it.
Yeah,
Okay.
Oh, you're on the phone?
Yeah.
Oh, sorry about that. Hold on just one moment. Hey, folks, I'm going to be real quick because, you know, these guys have only got a few minutes left. Whoops. Hold on.
I lost the sound.
Now YouTube can see us. All right. So we're going to be real quick. There's still time to call. Call now. Do what it says on the screen. 417-597-4821. Help us to continue doing the right thing. All right. I will be here in just a few minutes to send you guys out as soon as you're done with your show. But, yeah, 417-597-4821. Back to you guys.
Okay.
Great.
One other thing I want to say. Veterans Crisis Hotline, 1-800-273-8255, extension 1, 24/7. If you're out there and you're a veteran and you're depressed or you have thoughts of harming yourself, call that number. It's manned 24/7. Somebody will answer it, and somebody will talk to you and talk you through whatever they need to talk to you about. And that's something that we stress on the Veteran Show. We have a banner on the bottom most of the time with it on there, the Veterans Crisis Hotline, 800-273-8255, extension 1.
Hey, Brad, you still there?
I'm still here.
So, out of curiosity, it seems like from my experience, dental is always kind of an issue and stuff. With what configuration between Medicare, TRICARE, and a Medicare Advantage plan does a veteran possibly pick up dental?
So the Medicare Advantage plans are going to be the one that help cover the dental. And depending on the plan that you look at, each company has different pools of money that they put towards each area. So you're going to have comprehensive that really covers the oral exams as well as the fillings or the dentures or anything along that lines. And then you'll just have the preventative maintenance, so the preventative care, which is just do the exams and x-rays along through the year. So there's really two different avenues that you look at when you look at the dental plans. Your Medicare Advantage plan, the Humana one there, it's a lot of preventative. So I think it goes up to like $1,000 that gives you in reimbursement or towards 50% of the costs on your dental preventive maintenance measures. So again, those plans are designed to make sure that you are staying healthy. There was some research done some years ago that tooth decay and infections in the mouth actually led to hospitalization of a lot of our seniors. So the Medicare Advantage plans really tried to focus in on that area to say, okay, if this is one of the areas that's really causing uncomfortableness for our seniors, then that's what we're going to address. So that's where your dental plans come into play.
Well, and dental, and then, you know, the other thing that jogs my memory and stuff is hearing aids. Which way do they get the best coverage for that help?
That's really going to depend on the member. There are a couple companies or carriers that will have a reimbursement towards hearing aids. Some will be up to $500 per ear. Some will be $250. It just depends on the level of your hearing loss. Some will give you like a 50-50 percentage, so you can go with a higher grade hearing aid. Each carrier kind of has its own network that they'll work with for their hearing aids as well. So it's about just kind of looking through those and really looking at your personal needs to figure out which plan works for you. The Humana plan, they have their own in-network, which is a great hearing company with also giving back that $40 give-back plan.
Well, I know in the past I've given a couple of friends rides down to Fayetteville for cataract surgery, so I know that there's some eye care involved in the stuff with what the VA provides, but is there anything vision-wise people should know about?
Yeah, so these the Medicare Advantage plans will also address this area. They'll have their eye exams, their routine eye exams included. They'll also put forth a couple $100 towards contact lenses or eyeglasses per year, making sure that your prescriptions are up to date. It's a looking at that. Where's your eyesight? How can we keep you, visibly going so that you're not deteriorating in that year's time underneath that plan.
Well, and this all circles back to what Reverend Bruce started the show with. I know you weren't with us, Brad, but really just right out of the gate, he was talking about how so many veterans don't even ask for help. And I mean, here's three things: vision, dental, and hearing. That as we all get older, I know I'm preaching to the choir. We all, I mean, I don't know what your thoughts are, Brad, but I know you have a passion not only for helping people, but veterans in particular and stuff. Is there anything that you'd like to add to what we've talked about, or comments that maybe we haven't touched on and stuff? Our time's fast escaping. I just got a 2-minute sign, so we've got about 120 seconds.
You just make a great point, and I can wrap it up with this. Is there are a lot of options out there, and I think everyone, and veterans specifically, need to know those options. You can't make an informed decision without being educated about it. So ask someone, ask your local agent. You guys have my number. Tony, you've got a number there that you can help out too. We can help give you options so you're educated in your decision making.
Hey, Brad, what's your number real quick?
515-777-6782 is my cell phone. You can reach me right there on my cell.
And don't let that 515 area code fool you. He's not in Iowa now. He actually works out of the Kansas City region and is covering Missouri and a few other states quite a bit and stuff. So anyway, I tell you what, we'll cut you loose just because I know the show's winding down. Brad, thank you so much. I'm so grateful that you could spend a few minutes with us on this show dedicated to helping veterans. With Reverend Bruce. Reverend Leo was unable to make it today, but they do have a great ministry here in Springfield.
Yeah, and I also have your number also in my phone, Brad, so if anybody should contact me through the Veterans Church, I can give them your number.
We'd love to help them out, so thank you so much, Reverend Bruce. Thank you, Tony.
Okay, thank you so much. Take care.
Hey, guys.
Okay, how much time we got? We're out of time. Thank you for your attendance. Remember, the telethon.
Yes, and donate if you can.
Yeah, everybody, we're still at the 5,000 mark, and we're looking to go higher and higher. We need your help. So, thanks, fellas, over there.
All right.
Tony and Dad, thank you very much.
Thank
we
you.
will see you all here in just a few minutes with another show. Tune in and see what's up.
Okay. Thank you.